Sometimes life takes really unexpected turns, and I've always been passionate about talking men's health. You don't know what's around the corner. And back in 2018, I went on this morning to undergo a live testicular examination to discuss the importance about men checking themselves and how to do that correctly. It's really given me the drive to keep talking about this important topic, 'cause it's around 95% curable if diagnosed early. So today I'm joined by Dr. Naveen to unpack this important topic. So Dr. Naveen, thank you very much for joining me.
Thank you for having me, Chris.
And welcome. And we are in a change room. I think the important thing around this is the fact that, you know, as men in changing rooms, in sport teams, we do a lot of talking, but it's not necessarily on the topics which are actually important within our lives. You know, it's quite a stigmatized subject, talking about testicular, how we all shower together, as we know. But I feel for like women, it's a lot easier to do. They go down to the park, they go out for drinks, and they'll talk about those important subjects. But as men, we don't necessarily do that.
Yeah, I'd fully agree, Chris. I think it's one of those rare places that men are actually vulnerable, isn't it? As you say, we shower together, we talk together. This is like one place we can truly be open. So let's see if we can replicate some of that banter and...
Absolutely. And well, the first thing, checking your testicles. It's the easiest thing to do in the world, is it not?
It really is. And that would be easy for me to say as a doctor, but honestly speaking, a testicle is really a small structure. To check it takes literally seconds. And if we're asking you to check both your testicles once a month, which is the frequency we recommend, it shouldn't take very long at all.
And we got some props.
We do indeed.
So out comes the Satsuma. Right. Show me exactly how you should do this correctly.
All right. So a satsuma, as most men will know, is much bigger than their actual testicle is, but this is a little bigger just so we can demonstrate to our audience how to do an examination. The first thing is you want to stabilize your testicles. So if you take the finger and thumb of one hand and just hold your testicle or satsuma like this,
yeah.
Your other hand is free and you've got your finger and thumb on that hand, and all you want to do is just make sure you run around the entire smooth surface to make sure there's no lump on there. Your fingers have hundreds of nerve endings, in fact millions of nerve endings, so that if there was a lump on there, you'd pick it up really easily. So stabilizing the testicle, all you want to do is take your finger and thumb and just run them entirely around your testicle to make sure it's smooth, from one end down to the other. So maybe start at the top and work down, or start at the side and work to the other side, whichever is easier for you.
Is that easier to do when I know when we have a bath as men, everything relaxes,
yeah.
So it gives you a more kind of
spot on.
Full-on approach to it, I guess.
Yeah, absolutely. That's a great tip. So when you have a bath or a shower, the testicle actually falls down from the body because the testicle has to be slightly cooler than the body temperature. So having a bath or a shower, or even just having had a workout when you're hot and warm, can lower the testicles and make it much easier to examine your testicle as well.
And like you just mentioned then, you touched on it, so we're literally looking for any kind of lump or anything that doesn't feel natural.
Yeah, absolutely. So as I said, it should be completely smooth, just like that satsuma surface is. If there was a lump or a projection on there, so let's take, for example, a pea. If there was a pea stuck on that or a lentil stuck on that, hopefully your finger would pick that up quite easily, but you have to be feeling to know it's there. The body gives you no warning signs, so unless you're feeling, you're not going to know one is present.
And that is essentially what happened with my brother. So I did the live examination that day. I went home, I went to bed, as you do, and 3 o'clock in the morning he knocks on my door, and I did say to him, I was like, Ben, what are you doing? Wow. It's 3 in the morning. He goes, I think I've got a lump on my testicle. I said, well, I'm not getting up at 3 o'clock to check it right now. You can wait till the morning. And then he showed me in the morning, and obviously there was a lump there, which he then went and got diagnosed. But what would you recommend for people if they found a lump on their testicle? How would you then go about the secondary approach to that?
Yeah, well, thank you for sharing your story, Chris. And I think your brother took exactly the right approach in checking himself, and well done for having done so. What I'd say to anyone that feels a lump is don't be alarmed. There can be many things that can cause a lump, but we have to be concerned to rule out a possible cancer. In young men in particular, there are very few things that cause a lump. And so if you've got one, let a doctor do the work for you. And so you need to take yourself to the doctor so that they can do the next stage of investigation by referring you on to a specialist.
And I think what you just touched on there is very important. I mean, a lot of people don't necessarily want to put themselves through the anxiety of going and getting themselves checked out. They might kind of, I think a very common thing we do as men is like bypass the situation and put it to one side and think, okay, there's a slim chance it might be cancer, so I'm okay, I can deal with that. Because with testicular cancer, it is a pain-free situation, isn't it? It's not something which is visibly going to give you pain or any feeling to kind of alert you in that respect.
Yeah, absolutely.
And I feel like men, we can ignore that, we can put that to one side, and that's not a good approach, is it?
Yeah, no, spot on. I mean, I think as men, we tend to bury our heads in the sand, don't we? And unless there's a symptom such as pain or a rash or something which you can see or feel, you're not inclined to want to go and see a doctor. I'd say a couple of things. One is that testicular cancer actually affects younger men more than it affects older men. So men that are the age group that you're in, Chris, and your brother will certainly be affected more than, say, men in my age group. And so it's very important that you do recognise that. The second thing to say is that when you go to a doctor, I know for a patient or for a gentleman like your brother, it's the most daunting thing. But for a doctor, we probably see several a week actually, and it really is just run-of-the-mill, another gentleman with a testicular lump, let's refer onwards to a specialist. We'll do our best to make you feel as comfortable as possible, but it is important you get through the door, because if you don't, no help is available to you.
And I know while we're in a rugby change room, it's quite a fitting setting, because I was chatting to Gareth Thomas about this similar situation when we were doing some filming together. And he was essentially saying he doesn't want to, or he didn't want to check himself because he feels like what he doesn't know can't hurt him, right? Yeah. And I'm sure his approach would have changed in that respect. But the way I see that, I feel like if you do check yourself and you don't find a lump, or if you do find a lump and then you get it cleared as being fine, you can continue to check yourself every month, which you'd probably recommend. You can tell us a time frame in a minute. But if you check yourself then going on every month after that, it gives you that security in your head that if you then do find something afterwards, you've caught it early and at a good stage.
Yeah, that is spot on. So in terms of frequency, I would say do a check once every month. A good time, as you've recommended, is when you're just out of a bath or a shower, because the testicles are slightly lower than the body. Even after a workout, you're a lot warmer, and so doing it then is a good time as well. It takes literally seconds. So if the first time you do it, you may want to take a bit longer just to sort of get a real feel for how you do it. Yeah. I'd also say to men, get to know your testicles. We always tell our female patients to get to know their breasts when they do a breast exam, and the same applies to us as men as well. Get to know your testicle, get to know what normal for you feels like. And if you do it month on month on month, if there ever then is a change, you'll think, oh, hang on, that's not normal for me. Yeah. Let me go and take myself to a doctor.
Yeah, you can see it much clearly.
Yeah, absolutely. Whereas if the first time you do a check, like your brother perhaps, and that's the first time you pick up a lump, you may then wake up your sibling at 3 o'clock like your brother did with you and raise the alarm, which is absolutely fine to do. But you may also just think that's normal, and that would be really disastrous.
But it's literally 10, 15 seconds. That's all it is. It takes no time to check yourself. If you do that 10, 15 seconds on each testicle once a month, that's 30 seconds of your life.
Yeah. Thank you.
Which could save your life.
Yeah, it really isn't that big an ask, is it? But yeah, as long as you make it a routine, make it a regular thing for yourself, that's all we're asking you to do.
So why do we feel embarrassed about it? What is the problem?
It's hard to pin down, Chris. I mean, there's a couple of things that I spring to mind based on the patients that I've seen. I think one of the biggest things is an embarrassment about seeing a doctor and getting naked in front of them. But as I've said, doctors see naked people all the time. It's a part of our routine. We'll do our best to make you feel as comfortable as possible and just talk you through the process so you know exactly what's going on. I think another thing is the fear of the unknown. I think some patients come to us and recognise that they may have something wrong, but don't want to know what's going to happen next. For some men, being medicalised can be quite scary. Things like the fear of impotence, not being able to get erections, not being able to have children, which are not the case, by the way, can often cloud their ability to come and see us as well. So there's many myths and wives' tales out there as to why patients don't see doctors, but honestly, it's always the right thing to do. So please do bring yourself to a doctor whenever you need to.
I think one important thing you said there, Dr. Naveen, is you've seen everything as a doctor, and that is the thing for men to understand, especially people who want to go and get something looked at. There's nothing you haven't seen, so nothing's new to you guys, so that embarrassment factor shouldn't really be there, should it? Yeah,
absolutely. And I think it's important that we emphasise that. For a doctor, we see these things day in, day out, and really a good doctor will make you feel comfortable around that. We'll recognise the very brave step you've taken to come and see us, but it's then for us to make you feel comfortable and take the next steps for you.
And in a very basic form, what is that next step?
So if you have got a lump, without x-ray vision, we can't tell whether it is a serious lump or a non-serious one. So what we'll do is refer you to a specialist, and they'll do what's called an ultrasound scan. This kind of scan that pregnant women have over their tummy. So you'll have some jelly applied to your scrotal sac or your ball bag. We'll apply a probe over it, much like a deodorant roll-on, and that will give us a 3D image of your testicle. Completely painless, takes literally minutes to do, and it gives us an image of what's going on, and we can then decide next steps from there.
And then after that, what would be the next stages of a cancer diagnosis?
Yeah, great question. So as with any cancer, we then need to do something called staging to see how far the cancer has spread. And the great thing with the testicular cancer is that if it's caught early, it is completely curable. All cancers start off being contained, essentially. They're confined to a small area, and unless they've spread elsewhere, all we have to do is simply remove that cancer and you're completely cured. Now, testicular cancer grows relatively slowly in the first few months before it gets a lot faster and starts to spread elsewhere. So if we catch it in the first few months of it being there, you're really in a much better position than if it's a bit more further afield.
I think that's why it's important to remember that 95% curable
Yeah.
is a great reason in itself just to get yourself checked.
Yeah, absolutely. And if you consider testicular cancer, it's so easy to pick up as well. All you have to do is feel your balls through your testicular sac. And it takes, as we've said, about 30 seconds to do every month. It really is a very easy one to pick up. If you consider that other cancers that occur within the body can be much harder to pick up, we really have no excuse for not detecting and then treating and curing testicular cancer.
30 seconds of your life once a month
Yeah.
is not a long time to put aside for what could save your life, essentially.
Absolutely. I mean, when you consider how much time we spend on social media or watching TV or even an advert between one of our favourite programmes, that's longer than 30 seconds. So if we can do all those things, there's no reason why we can't check ourselves as well.
100%. So what things can we do to reduce our chances of getting testicular cancer? Are there any lifestyle factors we can change?
Great question, Chris. I mean, a lot of patients ask me, what can I do to reduce my risk? Because with the awareness, people are now looking to control their risk as well. What I will say is that with all cancers, so let's speak generally first of all, we know that there are certain things that certainly increase your risk of a cancer. Things like being a smoker, things like drinking too much, things like being overweight and not exercising enough. Those lifestyle factors certainly are cancer causing across the board. I will also say, though, that testicular cancer, because it occurs relatively early in life, means that you've not always had enough exposure to the harms of cigarette smoking or drinking too much or other things that could cause a cancer. And sometimes it is just bad luck that your testicles happen to develop a cancer in the circumstances that they do. We know that some people have a genetic predisposition to that, so sometimes you will hear about certain relatives in the family being affected or certain relatives being affected when somebody else is diagnosed. And so, aside from being healthy and just being vigilant to the cancer being there by doing a self-examination, there probably isn't much else that I'd recommend people do at this stage.
Obviously, a subject I talk loads about as well is my brother. He was the one who had testicular cancer. My cousin had it as well. His cancer becomes secondary of the abdomen, but thankfully it was fully cured as well. So again, it showcases the fact that testicular cancer is a hugely curable cancer.
Yeah.
Is it something which runs in the family? Is it something that people should worry about in the family? Is it genetically connected?
Yeah. Let me be really honest with you. I think medicine moves really, really fast, and we're constantly discovering new things about not just cancers, but all sorts of conditions. But speaking about cancer in particular, there is a real knowledge base now around which cancers do have a very strong genetic link. So there are certain kinds of breast cancer or bowel cancers that are very genetically driven. We haven't discovered a one-off gene that causes testicular cancer, but we can't deny that there are clusters of testicular cancer that occur in families. And I think your family is one example in point with around that. So we do know that there is some element of heredity in that equation. What I'd say is that if you have got a first-degree relative, such as a brother or a father, affected by testicular cancer, it does raise your risk quite considerably. Okay. If you've also got a second-degree relative, like a cousin, that also raises your risk. We're not sure by how much, but certainly does raise that concern there. So I'd say for all men to be checking themselves regularly is important, but especially those men who have relatives who are affected as well, because if they've been affected, you may have a similar gene or genetic makeup, which makes you prone to it as well.
Amazing, Dr. Naveen. That is very good advice for any man wanting to check themselves on how to do it correctly. And if you find something, do something.
Perfect.
Simple as that.
Absolutely. No, I think you've put the nail on the head, Chris. Being proactive is the most important thing. 30 seconds a month, not a big ask. And as long as you're doing that, you're good to go.
Now, there's loads of myths, loads of taboos when it comes to talking about our testicles. So before we sat down today, we got some questions off some young males in terms of what they wanted to know and what they wanted to learn. So hopefully we can help break it down for me, Dr. Naveen.
Let's give it a go.
That's an interesting question because I ride a bike quite a lot, so I want to know the answer to this as well. Does riding a bike affect it at all?
Yeah, not an uncommon question at all. And I think it's probably driven by the Lance Armstrong effect, that Tour de France cyclist who famously developed testicular cancer, and therefore people put bike riding and testicular cancer into the same equation. Let me reassure you that there's no conclusive evidence that links the two. So we have done studies to see whether there is a link between testicular cancer and cycling, and no study, as I say, has put those two together, despite reports that may occur in the press from time to time. One thing we do recognise, though, is that Tour de France cyclists and any long-distance cyclist who wears tight clothing and has their testicles close to their body is probably overheating their testicles and leading to a slightly lower sperm count for the duration of them taking part in that sport and for a few weeks or months afterwards. But testicular cancer certainly isn't linked with cycling.
Swollen testicles. Is that a worry at all if you do get it?
It's an interesting one because there are many things that can cause a swelling in the testicle, but a doctor is always going to take the most precautious approach and assume it's the most harmful thing it could be to make sure we're taking the right steps for you. But let's reassure our listeners, the kind of things that can cause a swelling vary from common old inflammation, which can cause swelling in your ankle or your wrist, for example. So if you've got, say, an injury from a footballing match or having hurt your area down below, a simple ibuprofen or a paracetamol may be enough to settle that down. Other things that can cause swelling are infection. There are both non-sexual and sexual infections that can occur that can cause a swelling of the testicle. They can occur weeks after catching the infection to months or even years after catching the infection as well. So if you do have a swelling and you've got fever or potentially pain with it, a doctor would want to know so we can help you with that.
So get yourself checked up if you've got any kind of swelling.
Absolutely. And I suppose the swelling we should be most concerned about is a testicular cancer. So while we've spoken about lumps in the testicle being an obvious sign of a testicular cancer, remember sometimes it's a swelling of the testicle. And so if you've got that, it could be cancerous too. Therefore, please see a doctor so we can help you with next steps.
Absolutely. Saggy testicles.
Saggy testicles. No one wants to talk about anything sagging, do they? But it is one of those things that comes to all of us in due course.
Is that just a sign of aging though?
Yeah, I think you're spot on, Chris. It really is. If you consider that all of our skin ages and sags, for want of a better word, we find that where you've got sort of a skeleton to support it, such as the skull supporting our face or our arms and legs supporting our skin there's less of a sag that occurs, whereas with the testicular sac or the ball bag, as we more commonly call it, there's no support there whatsoever. And with age and with gravity, it is going to sag a bit more. The other thing to say is that the testicles themselves change with age as well. So when we're younger men, we're producing a much higher rate of testosterone, and therefore our testicles are really big as our testosterone factories, and producing testosterone and circulating that around. As we get older, our testosterone production declines, and therefore our testicles start to shrink ever so slightly with age as well. You may not notice it year on year, but perhaps if you checked yourself every decade for testicular size, you would notice that one decade it was a certain size, and a decade later it would be slightly smaller.
It's very natural then.
Absolutely. These are very common age-related changes. Testicular size shrinking ever so slightly, the ball bag sagging a bit more. Nothing to be concerned or worried about. That's exactly what we'd expect.
Personally, I just prefer tight underwear. It's supportive, it's more comfortable in my opinion. Is that going to damage me at all?
Great question, and a lot of men ask us this because this is the trend now for clothing, isn't it? From a testicular cancer perspective then, let's reassure you and all our listeners that there is no link between tighter clothing, be it underwear or jeans, and testicular cancer, because if there was, let's just be really honest, there would be high rates of testicular cancer right now, given the commonality of these clothing items. What we do find though, as with anything that causes testicular temperature to rise, tight clothing and tight jeans being a part of this, is that if the temperature rises, it can lower your fertility ever so slightly because sperm production is affected if the testicles are too hot. So if you're looking to start a family, you may want to lay off the tight clothing for a couple of months, and once you've conceived as a couple, you can then resume those. But otherwise, no health effects that I'd be concerned by.
So more a fertility issue as opposed to a testicular cancer issue?
Yeah, absolutely. If we find a lump, we have to be cautious that it could be a cancer, and therefore we're going to take every step possible to get you seen, get this scanned, and give you an answer in terms of whether it's cancer or not. I will share that there are many things that can cause lumps in the testicle, but because the cancer is the most serious of those things, we have to assume it's that until proven otherwise.
And because testicular cancer is highly curable as well, it's something where, you would just encourage everybody obviously to get themselves checked out. But why live with the anxiety? Because you've got a big chance if you have got testicular cancer that you will cure it anyway. What
I would say is that please just be really kind to yourself. The sooner you take action, the more options there are available for you. If you sit on this for too long and your anxiety and worry get the better of you, we may waste valuable time, and actually you may have fewer options available, which you may come to regret later. So seeing a doctor as soon as you can.
Get yourself checked out.
Absolutely.
Dr. Naveen, thank you very much for that. Hopefully we broke down all the questions for all our viewers and everybody who tuned in. I think I learned a lot about testicular health, and for everybody who has watched this, who has viewed this, breaking down those taboos on testicular health is hugely important. If you need more information, head over to the Bupa website where there'll be further support. Thank you very much.